Okay, hi everybody. Welcome back from lunch. That was beautiful, by the way. It's the first time I've heard that one. I loved it. My name is Tyler Dahm. I'm a holistic health practitioner from Colorado, and I've been here so many times now, and I'm always honored to be here talking about the Ion Cleanse system. And I am brought here by Ion Cleanse by AMD, but I want to give you guys a disclaimer in case you didn't know this. I don't make money off the sales of machines, and I'm not connected with them financially other than my travel. The reason for that is because I use the machine for my son and his recovery from autism, and I'm very loyal to the product for the way that it works with our patients in our practice in Colorado as well. So I just wanted to get that out of the way. And now I want to talk to you guys about some really exciting research that we have been focused on as a company for the past couple of years, but specifically the past 6 months, we've really been diving into looking at the way that the machine is working in the body and how it's helping to facilitate detoxification. So in case you're not familiar with the Ion Cleanse system, is there anyone here today that doesn't know the system or how ion detoxification works at all? Oh, great. So there's a few people that are going to learn. This is awesome. So the Ion Cleanse system is a total body detoxification system. It's a safe, non-invasive tool that we use. It has some medical grade safety, which is really important. So the power supply that it uses is medical grade. The steel plates that we're using is medical grade stainless steel, which I think is important when you're working inside the body. It has a patented technology with it. The company's been around for 15 years. It was developed by Dr. Maroney and his team of engineers at that time. And it's made in the USA, but it also has an A+ rating with the Better Business Bureau. Now that I have done that, I want to talk about the research. So how many of you guys are familiar with Myasthenia gravis? A lot of you. That would make sense to me because this is a devastating autoimmune condition. Why is it devastating compared to other conditions? I think because Myasthenia gravis, it's rare and there's not a lot of people who know how to treat it as a practitioner. There are treatments for it to help manage the symptoms, but oftentimes we don't hear of improvement at all in this condition. It's more about just maintaining the level where you're at when they catch the diagnosis. And also because a lot of the treatment that they do comes with some pretty devastating side effects. And we're going to talk about that actually. And of course, there's no cure for MG. So what we did was, there was a nonprofit organization called Women with MG. They reached out to the Ion Cleanse company because one of the founders of the nonprofit used the machine for her daughter that has autism, and she saw great success with it. She decided to start using it for herself as well and kind of see where she would get with her MG diagnosis. And she started noticing vast improvement in her symptomology, which she was not expecting at all. So she came to the company and asked if it would be possible if her group could do a study using the machines. And this is what they found, and I love this. They had 24 participants. So 17 of those participants were the control. Those were the people that opted not to use the new technology to assess their symptoms, and they didn't want to participate with the Ion Cleanse. They were scared, and understandably, because new things for them can often activate aggravation in their symptomology, so they didn't want to mess with it. But 7 of them decided to go ahead and join the study using the Ion Cleanse system. And it was the only thing that they changed in their protocol. It was the only therapy that they introduced. Everything they were already doing stayed the same. They were not allowed to introduce anything additional besides the Ion Cleanse during that time. They have a really great evaluation tool that they have developed. So if you've ever heard me talk about the ATEC for autism, it's the Autism Treatment Evaluation Checklist. This is the Myasthenia gravis checklist. This is what they do to track their symptomology that lets us know whether they're having an improvement or not. It's basically created of 3 separate sections. So section 1 is the symptoms, and that's 47 questions. Section 2 is accommodations and assistive devices that they may need. So a lot of times Myasthenia gravis patients will end up in wheelchairs, or they'll have canes, or some of them even have to have assistive technology devices because they're having late onset apraxia, which is just devastating. And that's based on 24 questions. And section 3 is just for simple commenting and anecdotal evidence that they're seeing. This is what the data came back as when we got the scoring back. So if you can see here, the control group actually started out at the baseline at 0, and over the period of 90 days, this is what they did. They had a 5% increase in their symptomology. But the MG group that was using the Ion Cleanse system had a 38% reduction in their symptomology with their MG. 38% reduction for a condition that is not known to even have improvement in its symptoms. That is pretty incredible. The pain-related score. This is important. When you have chronically ill patients and they're in pain, oftentimes that will be one of the biggest battles that you are faced, because they're not receptive to treatment sometimes, or if that pain level is interfering with their ability to come seek you out and get treatment, then they're not accessing the care that they need. So you can see that in the beginning of utilizing the Ion Cleanse system, they actually had a slight uptick in their pain. But then as they continued to use it, it goes down. Their pain symptomology decreases by 40% over the 90-day window. That is obviously a dramatic improvement for these patients that are told to basically go home, get on their pharma opioids, and live the rest of their life until their liver and their kidneys fail. This is what they are told in practice. Cognitive score issues. This is really great. I mean, obviously cognitive function is everything that we do. It's how we relate to all of our, everyone around us basically in our day-to-day functioning. So the control group, by the end of the 90 days, goes up 2% in their cognitive function, meaning that they're not seeing a reduction in their ability to have cognitive function. But after 90 days, the Ion Cleanse group goes down 39% in their symptoms of cognitive decline. 39%. This one is kind of personal to me, because the mom with MG that also had a daughter with autism, I have gotten to know her through this process. She has been hospitalized every month for the past 2 years before starting to use her Ion Cleanse system. Oftentimes with MG, this is either related to the disease or it's related to the treatment that they do to manage the disease. So imagine what it's like to be raising a child with autism that is severely affected, and then every month you're going into the hospital, and sometimes you don't know if you're going to come out. She has had patients in her group for moms with Myasthenia gravis that have gone in for simple pneumonia and they didn't make it home to their family. So with the control group, 59% of them, 10 of the control participants, had a hospitalization in that 90-day window. 0% of the patients using their Ion Cleanse system in 90 days went to the hospital. I cannot think of any more powerful slide than that one, because avoiding the hospital is obviously going to be your best bet for survival. Don't tell anybody I said that. Real life experience. This is some feedback that was given through the Facebook group that was monitoring this study. This is Ruth, and she says, I wanted to report on my MSEC score. Before starting, it was 178. After just 1 month of Ion Cleanse foot bathing, my MSEC has dropped to 122. I'm so happy. Thank you, Debbie Norman, and everyone who participated in this trial. I can hardly believe the results. This is phenomenal. I've also dropped down to only 2 Mestanin a day, 1 in the morning and 1 at night. I'm so pleased with the results. I can't really say enough about this product. So 31% MG symptomology reduction, and she was only using the machine for 1 month. That was her 1 month feedback. That's very impressive. Other common autoimmune conditions that we are getting feedback on every single day: multiple sclerosis, RA, inflammatory bowel disease, type 1 diabetes. This is really important. Graves' disease. So we think about it in terms of this. If MG is a devastating autoimmune disease, what other autoimmune diseases can we affect by doing Ion Cleanse system? It has the potential to reach into everything. I don't think that there's any condition that it can't have a positive impact if that patient, if it's going to be a benefit to them. Let's talk a little bit about the IRB study for metal excretion. So we get this all the time. Will the Ion Cleanse by AMD facilitate total detoxification even after the Footbath session is over? Well, I didn't know that answer, even though I used it clinically for 3 years before, kind of starting to study it. But thanks to Dr. Klinghardt, who we came here and we learned from him, we got the most invaluable data. And he said, and he's been saying for a while, that usually around like 72 hours after the initial session of the ion cleanse or ion detoxification in general, they will see the most excretion of toxic metals. And so we went ahead and did an IRB study testing that theory, and he was absolutely right. Of course he was right. So, so this is what it was. The control group, there was a control that did the 24-hour urine collection. So 24 hours for 5 days before doing the ion cleanse session, all of the urine was collected. And then after they did one ion cleanse session for 30 minutes, they did another 5 days of 24-hour urine collection. And that was the control versus the post session. And we used the Genova Diagnostic Comprehensive Urine Element Profile. This was just the profile that had the most comprehensive of what metals that they could test for us. So this is what we used. And the preliminary study data was the male that was 35 years old, just from one ion cleanse session for half an hour, he had an increase in his toxic metal excretion for 154%. And I thought that was really amazing, just at that 72-hour mark. And the male that was 69 after his one half-an-hour session had his excretion at 61%. But I started asking myself, why the difference? Why is the 69-year-old male excreting less toxic metals than the 35-year-old male? And this is really great. We didn't use this, we didn't report the findings as far as why this male had this. But here's what's interesting. I know this gentleman from meeting him through this process, and he has 2 boys with autism. 2 boys, both his children affected with autism. One is now recovered thanks to using his ion cleanse system, but the other one is still severely affected. It stands to reason that he is probably detoxification compromised. So I bet if we were to go in and look at his genetics, we would see it. I bet if we were to look at his other factors of diet and lifestyle and all of these things, we would find it. But it made absolute sense to me that he would be excreting higher levels of metal because he wasn't excreting previously. He's toxic, like all of us of our generation are toxic. Second IRB study, metal excretion. So it's the exact same format as the preliminary study. This one was done by one of our MAPS doctors that did not believe in the ion cleanse technology. He thought it was a joke, and he wanted to prove us wrong, and I love that. That is my favorite thing ever because I will always inevitably make them my best friend because I know that the technology works. So he went ahead and he did a group of 28 children, and those, is it me? 1 second. Okay. Oh, it's me. I'm probably radioactive, sorry. So I'm just gonna leave that up. Oh, no I'm not. I'm gonna hold it like this. So, okay, as long as you guys can still hear me, we're ready to roll. So 28 children were the participants. These children were ages 2 to 18. And they all have a formal ASD diagnosis. Okay, awesome, we're good. So this study is still in progress, this IRB, but this is the preliminary data that we've gotten back so far. Of the children that we've gotten the data back on, 32% increase in their metal excretion, and that is after their one session. This is one 30-minute session with their ion cleanse, doing the 5-day urine, 24-hour urine collection, and then post 5-day urine collection. The metals in that 32% that we're seeing excreted are as follows: mercury, aluminum, antimony, arsenic, barium, cadmium, cesium, the other one I can't say, the gadolinium, nickel, the niobium, platinum, rubidium, thallium, tungsten, and uranium. These are the metals specifically that these children excreted after one ion cleanse session. Autism study number 1. So this is really important because this is the study that we kind of started learning about autism and how we could potentially use it in our practice to improve the outcome for these kids. This particular study was done with 24 participants. It was a 4-month study, and this is where we utilized that ATEC score. So the ATEC score is that Autism Treatment Evaluation Checklist. At the beginning, we asked all of the families and practitioners, if they were working with the kiddos, to go ahead and fill out this evaluation on this child and to tell us what the severity of their autism symptoms were in that moment. And then each month after doing their ion cleanse at the protocol that we gave them, we would go ahead and retest the ATEX score. No other protocols were included, but we also did not ask them to change the current stuff that they were doing because every child was on a specific regimen. The only criteria was that they could add the ion cleanse and change nothing else. This is what we found after the first 4-month period. These kids specifically had a 35% reduction in their ATEX score. So this protocol was based off of every other day, 30 minutes, and they had 35% reduction in their autism symptomology. This is autism study number 2. This is where we sort of found the key and the magic for being able to use the ion detox system for these kids and get the biggest bang for our buck when they're using it. There's 27 participants. There's 10 teenagers in this study now. 10 teenagers whose families are really looking for an answer for their children who are still affected. This is also a 4-month study. This time around, we changed the protocol. We changed it to 3 days on, 1 day off. That protocol was developed based on feedback from the families that children who were verbal were asking to cleanse back-to-back days. Children who were pre-verbal were bringing the Footbath pan and asking to continually cleanse. So we took that back to our practitioners and started theorizing why that was, and we ran with this different protocol, and this was the results. After that 4-month period of testing it, 3 days on, 1 day off, 55% reduction in their ATEX score. So on average, we had children that were losing half of the symptomology of their autism. That is really incredible. But this is actually my favorite part. The kids 4 to 9 did 45%. The kids 10 to 12 did 57%. But our teenagers, those 10 kids that were in that study, they did 64% reduction in their ATEX score. Kids 13 to 19. These are the same kids that all of our doctors and practitioners are telling these families that, oh, it's too late. You've missed that window. They're not going to get better. Take them home. Put them in an institution. There's nothing more to be done. These are even some of the doctors working in our community for autism that believe in this window. This data shows me that that window does not exist and that these kids can and do improve with the right treatment protocols at any age. And if I can tell a family that it's never too late for their child and that that hope does not die there with those words from an untrained practitioner, that is priceless. That is a priceless gift that we have given that family. Okay. Okay. Elephant in the room. All right. I want to see a show of hands. How many of you, even now or previously, do not believe in this technology? Oh, come on. Who's my skeptics? It's okay. It's okay. I was there too. So okay. Thank you. I appreciate that. So here's the thing. When you're using ion detoxification, color change is not indication of detox. You can put a current into the water and add a little salt and you're going to get color change. There's so much more that goes into having effective ion detoxification that's actually working inside the body to facilitate detoxification. I learned this the hard way by using a different system with my son before we got started with the ion cleanse. So I really want you guys to understand that for me as a clinician that uses this tool, having used a previous machine, there's some things you need to look for so that you know that your system is legit. And there are some legit systems out there, but you have to find them. And so this due diligence checklist is important. Make sure that they have documented research. Make sure that they're putting their money where their mouth is and that they're willing to test their system and prove that it's doing what it says when it comes to excretion and detoxification. Make sure they have safety reports. You know, I think it's false to say that it's safe for everybody to just put their feet in the water with an electrical current and then that's going to create detox. It can go wrong and it has gone wrong with other systems. So please look for safety records. That is really important, especially if you're working with children. They are very sensitive to electrical currents in their body, especially if they're not biocompatible. So when it's done wrong, you may be undoing all the good work that you're trying to do. Definitely you want to look for dual polarity. Why is that important? Well, we have positively charged toxins, but we also have negatively charged toxins in our body. If your machine only does one polarity, then you're missing half of the detox picture. So it's important to look for that. If you have something go wrong, if you have a contraindication, and you want to make sure that you cross-check that before you put your feet in the water. Make sure that the company you're getting your system from is educated enough to guide you through that, so that you're not just putting your feet into a system that actually may not be what you're supposed to be using. And also, I think it's really important to have a money-back guarantee. For me personally, as an autism mom who spent $80,000 before I found my system to try to heal my son, I don't want anybody to waste another dollar. I know that this tool is not going to work for every single parent. I have friends who've had to send it back. They didn't get the results that we got with my son. So I don't want anybody to not have that in place. I think it's very important, and it speaks to integrity, because treatment is expensive. You guys know this. How many of us have patients that come and say, can you help me? I don't have any money. All of us, right? So at least if we're going to ask them to buy a tool, we need to back it up in case it doesn't work for them, because some of them it won't. Okay, I want to talk a little bit about the science behind it and how it works in the body. I have this analogy that I like to use, and I think about it in terms of this. When we have a chronic health condition in any patient or in ourselves, I think about the body in terms as being a house. And when we are chronically ill, that house has burnt to the ground. And we get so quick in medicine sometimes to go in and throw all this stuff at our patients, and we want to rebuild that house as quickly as we can. But sometimes we forget to take a step back and do two things, and that's identify the source of the fire and then clear away the rubble. And I really think that that's where some of us, we can go wrong in treatment. We have a lot of patients that have impaired communication and transport. This, Dr. Amy Dirksen talked a lot about this. She's seeing this huge uptick in these autoimmunity antibodies coming back on our labs. And I'm seeing a lot of toxicity in our kids. I will use the Great Plains laboratory test called the GPL Tox. One of the things that I do in practice is I look for glyphosate in our children, because it is on the rise. Even in some of our organic foods, they're getting exposure. And now we're seeing this new subset of kids that all of a sudden, even if they're neurotypical, they're not excreting their toxic metals. They're not excreting their chemical byproducts. Why is this happening? Why are all of our kids becoming so toxic and now having autoimmune issues on top of things like autism and neurodegenerative conditions? So that is a big issue. Now, when that happens, that's something that goes right into what I call I don't call it, it is called the voltage-gated ion channels. These voltage-gated ion channels are sodium ion channels, potassium ion channels, calcium ion channels. How many of us work in methylation? How many of you guys pull epigenetic mutations or do genetics in your practice? A good portion of you. So when you're looking at that, well, methylation is a sodium ion channel. That's exactly how it works. And so if these voltage-gated ion channels, from what we know about studies, have shown that if you have lead or mercury or certain chemical toxins like pesticide and herbicides, they will shut down these voltage-gated ion channels. This is how the cell moves nutrition in and toxicity out. It's a charge that fires open that cell wall as an action potential. If you are toxic in your body, and infections can do this as well, which is why it's important to screen for those, but if you're toxic in your body, that process isn't flowing, and that is your transport system. That's literally every process in your body at the cellular level. So basically, that leads to what's called an ion channelopathy. And that just means that those pathways aren't functioning appropriately. Why is that important? Is because, well, when those voltage-gated ion channels aren't firing, this is what we start to see. We start to see those epigenetic changes. Those mutations begin expressing because things aren't moving through appropriately. We get environmental and chemical sensitivities, nutritional deficiencies. We have hydration issues. How many of us that work with children have kids that you can pump them full of water all day long and they still can't poop? A lot of times it's because they have a transport issue, and that motility, it's not working for them anymore. And their nerve cells aren't firing appropriately anymore in the colon either, so then we start seeing things like encopresis, and that's a really bad scenario. Impaired detoxification and impaired cell function. It's all really tied in together. Some of the basic epigenetic changes that I will see with this is MTHFR, MAOA, CYP, CBS. We'll see some NAT and some SOD. COMP mutations that will pair with these are also really important. It's critical to detoxify our patients, but Why is ion detoxification so much more powerful for some of our patients? And the reason is really simple. We have these tools like oral chelation, IV chelation. We've got drops and binders and drainers. We've got dietary and organ cleanses and herbals. We have all of these tools. But have you ever had a patient that you've kind of thrown everything at them and nothing has stuck and you can't get their body to detoxify? It's probably because they have a channelopathy. They've got a breakdown in their transport. So you're flooding their body with all this great stuff and it's not getting where it needs to go to be effective. It can't be utilized properly. So how do we detoxify a patient that can't transport the good stuff in and detox the bad stuff out? And that's really what we started learning about ion cleanse, ion detoxification. Because we've got these blocked pathways and receptors. Once those are blocked, they're not going to refire. And then everything you're putting into the body is just going to keep stacking up. It's going to create a log jam. Even if it's something beneficial, if it can't be used, it all has the potential to become toxic in the body over time. And that's when we see a lot of Herx reactions. And so I'm just going to kind of leave some of these slides for you. This is just a graphic that we developed to kind of show the onset of infection and then how the systems begin to break down with that. Ion detoxification, why is it different? How does it work? So basically, I'm going to just break it down into two simple steps. Ion detoxification becomes the proxy for your transport system to excrete toxins where your body cannot do it for itself anymore, or at least not at an efficient level. What we are doing is we're doing two simple processes. Step one is to use an electrical current that has been filtered in a very specific pattern to communicate to the body a relaxation response. If we've done our job and we've done that right, then that's going to activate the parasympathetic nervous system. Once we've done that, and during that session we've shifted that patient over to parasympathetic, well then we're going to begin to facilitate rest and digest, and that's our detox process. This is how the body knows to signal to discharge that toxicity and set it aside for excretion. So that's step one. But step two takes it a little bit further. So now we're using the positive and negative ion charges in the water field to then draw that toxicity out of the body. We're trying to move it back through the pathways and get it out for excretion. So the ion cleanse system specifically changes between positive and negative throughout that session. And it becomes a draw mechanism like a pump, positive, negative, positive, negative. It can detoxify through the feet, through the eccrine gland system. This is a detox route that the body will use. But primarily what it does is works inside the body systemically just to help shift that toxicity back into the other specific organs for detox, the colon, the kidneys, the liver, etc. And so the bulk of the detoxification that's going to occur will be inside the body and not in the water. And again, I want to remind you that color change is not indicative of detox. That is a misnomer. We talked about that. Okay, so that's a basic quick primer, but I know you guys always have questions every time we're here, so I'm just going to open it up for a few minutes to questions, if anybody has any. Yeah?
So why do you see the different changes in color in people then?
Yeah. So she asked, why do we see the different changes in color from person to person? I think that is a prime example of excretion that is occurring through the feet. And I do believe that it happens, and I know that it happens. I've had a kid come into the clinic, put his feet in, and after a 40-minute session, we had pinworms in the water. I've only seen it once. I've never seen it again. But I think it's absolutely crazy to say that we can't detox through our feet. That obviously we can. But I don't think everybody detoxes through their feet. I think the bulk of the detox is happening in the body. But when we see color change, like this person's green, this person's brown, this person's black, that is obviously because their body is the variable that's creating that excretion. It's the body interacting with that machine at that time. Yes?
You see aggravations if kids, it seems like you're liberating.
Right.
It seems like you're liberating, and I'm just wondering if you're seeing any aggravation for people that with compromised liver, kidney, gut function.
Yes, absolutely. So aggravations can occur, of course, in any detox tool that you use, and we've all seen it in practice. But the ion cleanse system, why I chose it and why I'm so passionate about it is because when I look at other tools that we've used, this actually helps calm down Herx reactions and aggravations. I actually think it's incredible that Dr. Hirani had that in her slide where she talked about how she uses it for Herx reactions, because that has been my experience as well. that where a patient who is more acutely ill, like with MG, that is so sensitive that any other tool they would have been just dead dog sick, that is how they can handle the detox. Now, has it ever not happened with the ion cleanse? Absolutely. We've had one particular boy with ASD had an unknown mito condition, and it was classic mito, and all his doctors missed it. We started detoxing him at an intense protocol, and he went to a mito crash. We were able to pull him back out of it, but yeah, it can happen, and any detox for sure. Yes?
I hate to bother you. Can you go back to that slide where you had the little thing? I wanted to take a picture.
The vicious cycle?
Yeah.
Of course.
That was a lovely slide.
There you go. Oh,
Are there any
looks
other
like there's
questions
just
here?
one right back there.
Do you know if the same process happens with the detoxification foot pads?
I don't have enough to speak about, and I think you're referring to Kanoki, the Japanese foot pads that will go on the feet. I have never used those, so I don't have enough data to speak about it. I think those oftentimes will use an herbal formulation to activate. I could be wrong. So yeah, I'm sorry, I don't know. It's fermented bamboo, says Dr. Klinghardt. That's I'm gonna have to read about that.
It seems to do a similar thing.
Oh yes, the process is absolutely similar. So really anything that you're using that eccrine gland system to draw out, whether you're using it biochemically with a reaction of an agent or whether you're using it energetically through ions and electricity, it's the same process of using that eccrine gland detox system to draw toxins through the feet. Absolutely.
One more?
Is this used generally as like a standalone treatment, or do you use it in conjunction with other medications or herbals?
Yeah, great question. So it's absolutely compatible with any other protocol that you're doing. We have over 5,000 families using this machine in a Facebook group online that was started by a bunch of moms from the first study, and all of them are doing different protocols. All of them are doing forms of chelation or energetic or hyperbaric and herbals, and there is no issue with it undoing any other protocol. It actually seems to benefit those protocols, and the way that I recommend it is that if you're going to do any other form of treatment, let it be the last thing that you do so that it's that draw effect to help clear the work that you've done, especially if you're just like working on that, and send them out the door. Oh.
We had some really good experience in England by also doing the hands. Can you comment on that, what your experience is?
Yeah. So Dr. K said that they had some really great experience in England by doing it on the hands. And I think that that exactly is a perfect example of how it's an energetic detoxification device. Once you're skin-to-skin contact, and especially because the hands also have sort of like an eccrine pathway in them as well, the palms of the hands and the bottom of the feet, any surface that you're using will be effective, but these with the most sweat glands that we have in the larger pores will also be very effective. So if you have patients, say for instance, and this actually happened in a practice back east, if you have a patient that may be a military vet and they don't have legs, how are you going to do a foot bath with them? You can easily and effectively facilitate that through the hands. And there are some people that just don't like to cleanse their feet. They prefer their hands, and they feel as though they get a better response from cleansing their hands. And I think it's equally effective, and it should be patient choice.
So you were mentioning that the frequencies initiate the detox. Are the frequencies causing reflexes as well, kind of like what you would think with the hands and feet reflexology type of responses? That's one question. And then the other question is, can you do simultaneously other treatments with the foot detoxes, so IVs, nasal ozone, or anything like that?
I love that. Both questions are great. So the way that we think about it in terms of how it works electrically, so it's two different things because ion, energetic, and then we are having an electrical current, so it's an energetic tool. There has been some testing that the company has done a while back where it showed the different meridian points lighting up that tended to correlate with the color of the water in that moment. That's not really my wheelhouse because I'm a biochemist by training, so I can't speak to that specifically, but it seems to be that what we're doing is just working inside the autonomic nervous system so that we are balancing between the two. One thing that we have seen is that patients that are in chronic fight or flight, that they're stuck in that sympathetic nervous system response, It tends to pull them out immediately by doing the session. But then over time, the more that they use the machine, it retrains that fight or flight mechanism to stay in PNS longer. And then it gets easier to shift back over into PNS. So we believe there's also a benefit to it retraining the autonomic nervous system response, which is great. And then there is also, you asked about, using it with other treatments simultaneously. Yes, you can. There are people who use the system inside their infrared sauna. There are people that will use the system with IV therapies. They will do it while doing laser, cold laser therapy. Really anything is fine. There's no contraindication with that.
Oh, no, I was going to ask, is there a specific benefit from doing it with the feet or the hands? Like, would you use it for a specific type of case to do the hands?
Me personally, I don't have enough data to say because primarily my practice uses it with their feet. I don't know, do you have anything to elaborate on that? Yes. Yeah, I'd rather have you have the info.
No, we see better improvements with eyesight and tinnitus and some of the brain-related symptoms. It seems to go quicker through the hand. And then also, many of us are using the oligoscan. And those of you who do, you realize that the oligoscan never changes in the hand because whatever is stuck in there stays stuck. And so to get a true reading of a repeat oligoscan, you have to do, we do like the hands about every fourth time, so 3 foot baths, 1 hand bath. And then the oligoscan actually starts staying current, representing what's in the rest of the body. Otherwise, the oligoscan looks much more toxic than the rest of the body is. And so those of you who use the oligoscan, just include the hands, and then you see major shifts that actually reflect the success that you have with the detox program. Otherwise, you think after 2 years, the oligoscan still hasn't changed, that you haven't achieved anything when you in fact have.
Well, that was really cool. I did not know that. Thank you.
Okay, we have time for one more question over here, and that'll be it.
I'm curious if you know if there's any excretion of any minerals or anything like that with this, or if you need to kind of supplement with minerals after.
That's a great question. So the answer is yes, and here's why. We have the potential to see minerals as an excretion in the water. There's been some doctors that have done before and after testing. It is not the minerals that we think of that are actively being used by the body. This system does not have a mechanism to reach in and grab anything. It only has the potential to draw the charge that's already been excreted. If your body is using, say, magnesium or zinc in that moment, and it actually is using it actively instead of being in a stored state in the body, it will already have a positive and negative charge as a bond. It's only after the body has discharged it for excretion that it has an available charge to be drawn out. So if we were to see magnesium or zinc or any of the really beneficial things in our body in the water after, it's because it was either an incompatible form for the body or it was in excess and it couldn't be used. I always recommend every patient do minerals during any form of detox because we burn so much ATP when we are detoxing, but for me, it's not an issue as far as a depletion. We have families that have opted out of doing minerals because it aggravates their children's symptoms, and we have not seen any issues with deficiency. All right, thank you.
Thank you, Tyler. Appreciate it. Very informative. Thank